In fact, we are getting an update coming in from Britain. We are learning that Boris Johnson is holding a briefing on the coronavirus outbreak. Let's listen.
The plan has 4 strands: containing the virus, delaying its spread, researching its origins and cure, and finally mitigating the impact should the virus become more widespread. That is, contain, delay, research, mitigate. And let me be absolutely clear that for the overwhelming majority of people who contract the virus, this will be a mild disease from which they will speedily and fully recover, as we've already seen. But I fully understand public concern, your concern about the global spread of the virus, and it is highly likely that we will see a growing number of UK cases. And that's why keeping the country safe is the government's overriding priority. And our plan means we're committed to doing everything possible, based on the advice of our world-leading scientific experts, to prepare for all eventualities. And let's not forget, we already have a fantastic NHS, fantastic testing systems, and fantastic surveillance of the spread of the disease. We will make sure the NHS gets all the support it needs to continue their brilliant response to the virus so far. The plan does not set out what the government will do. It sets out the steps that we could take at the right time and on the basis of the scientific advice. Our country remains extremely well prepared, as it has been since the outbreak began in Wuhan several months ago. Finally, crucially, we must not forget what we can all do to fight this virus, which is to wash our hands. You knew I was going to say this, but wash our hands with soap and water. And forgive me for repeating this, but there will be people first tuning into this for the first time. Wash your hands with soap and hot water for the length of time it takes to sing Happy Birthday twice. It's simple advice, but it's the single most important thing we can do, as I think our experts would attest. But at this stage, and with the exception of all the points that I have just mentioned, I want to stress that for the vast majority of the people of this country, we should be going about our business as usual. And on that note, I will hand over to all of you to ask questions to the Chief Medical Officer and the Chief Scientific Advisor. And I'm going to go to you guys in the media, and Laura Koonsberg from the BBC.
Thank you very much, Prime Minister. First of all, Prime Minister, are you telling people today that sooner or later all of our lives are going to be disrupted somehow? And a question to the Chief Medical Officer and the Chief Scientific Advisor, if I may. Do you believe at some point this virus will be bigger than any effort the government can make to try to contain it? And to the Chief Medical Officer, what is your best guess, if you can, of how many people will actually get this disease, even bearing in mind that for the majority of people it's mild and won't do any long-term harm?
Well, Laura, I think the answer to your question is, I'm afraid at this stage it is just, I think, too early to say. But I'll hand over to our experts on that.
There's a key point about timing here. And there are a number of measures that could be taken to try and reduce the peak and flatten it a bit so we haven't got such a sharp number of people at any one time. And the question is at what time to implement which measures. If you do it too early, you end up with a lot of people having disruption, a lot of societal disruption, at a time you're not getting benefit. And you also ask a lot of people to go on for a long time doing this, whereas what we really want to do is to implement the whatever's necessary at the time, depending on how the epidemic goes, at the right time over a 12-week period or so is probably what's going to be needed to do it. So we don't want to go too early. And those measures, of course, are the ones that are laid out in the document. It doesn't mean all of those need to happen. It depends on the nature of the outbreak. We're modelling all of the interventions at the moment and trying to look at what the right combination is at what stage. And, of course, central to all of this is making sure that we protect the vulnerable. And the highest risk groups are the elderly and those with pre-existing illness. And those are the ones we've got to make most care to protect during this. And as the Prime Minister says, the vast majority of people will end up with a mild illness. So the timing is critical, and it's not now. And we're looking very carefully at when the time is right and what the combination of things are that are going to make the biggest difference.
Thanks very much. Prince
just to add on from that, I mean, the first thing is you asked me specifically about the best guess on numbers. There are certain things we know now, and I think we're reasonably confident that overall, probably around 1% of people who get this virus might end up dying based on the Chinese experience. Now, to be clear, what that therefore means is 99% of people will not. And if, as I think is entirely possible, a higher proportion than we currently are aware of get the infection without any symptoms, in fact, that mortality rate will go down. But let's take 1% overall as the current reasonable figure. It goes up a bit in people who are older or more vulnerable, as Sir Patrick said. It will be much lower than that in younger people who actually have no other health problems. So that bit of the information we know for sure. The bit of information that we don't know, there are two bits that are critical. The proportion of people who have no symptoms at all, and that's because we don't currently have tests which can work out if someone has had an infection with no symptoms at all. So it may be, for example, in China, a very large number of people have been infected with no symptoms and are not being counted in the numbers. So we don't know that. And the second thing we cannot be sure of is what proportion of the population can get infected. Now, it will not go above 80%, so for planning purposes, of course, we go up to the highest rate that it reasonably could. But in reality, my view and Patrick's view are that the proportion of the population who get infected is likely to be lower than that and probably a lot lower than that. So I think putting an overall number is largely speculative, but those are, I think, the key things it's important for people to understand.
So if you look at Wuhan, it's clearly not 80% of the population that's infected with a 1% mortality rate. And so we can learn from that this is likely to be lower than that. Of course, things could still change in Wuhan, and that could turn out to be different as they release some of the containment measures. But it's definitely a lot lower than that. And so I think what we're doing is building on the reasonable worst-case scenario, which is the one that Chris has laid out for planning purposes, which is the appropriate thing to do, and then looking very carefully at how this evolves and what the numbers might turn out to be.
Thanks, Patrick. Robert Peston, ITN.
Couple of questions. The action plan you published today says there's a possibility that a fifth of working people will be off work during the peak period. Prime Minister, what will you do to make sure that those who are ill don't also suffer hardship, particularly those on low pay? And secondly, we're still in the containment phase. What would we have to see here to move into the phase of simply delaying an epidemic?
Well, thanks, Robert. On the issue of statutory sick pay and the risks that the workforce could conceivably run in that worst case, reasonable worst case scenario that you describe, we're going to keep all options under review, but we're well aware of the issue.
Yes, sorry. In terms of moving from containment to delay, the first point to make is that most of the things that we do to try and help contain the virus, like finding the early cases and isolating them, also are very important for delay. So they serve both purposes. There will come a point, potentially, and not definitely, but there will come a point, potentially, where the amount of transmission, either in the UK or, equally likely, everywhere in the world, is so great that actually the idea of containing, which is to say essentially getting rid of this virus completely, ceases to make sense. We have not reached that point, but we could reach that point. And at that point, we will move over to saying, well, that bit is stopped. But to be clear, many of the things...
Right, this was the press briefing being held by British Prime Minister Boris Johnson. The Boris Johnson government published the Coronavirus Action Plan. It's a 27-page document, and it lists out measures that the Boris Johnson government would take in case of a major outbreak in the UK. And it lists out measures like closing down of schools, in reducing the number of public gatherings, 1 in 5 people being off work at peak time, and with the National Health Service also prioritizing coronavirus cases over less critical cases. So these are the measures that have been listed out. British Prime Minister also saying that the country remains fully prepared to deal with the coronavirus.